Well, thank you for coming along to listen to this session on diabetes mellitus. I'm sure many of you have got cats and dogs with this disease, and hopefully you're going to learn some things through this session. So welcome. So this is what we're going to talk about over the next 45-50 minutes or so. First, I'm going to pose a few questions just for you to have a little think about. Not expecting any answers. I'm certainly not going to be looking for those answers, but just have a think about these questions. It's some potentially common misconceptions about how we manage diabetic dogs and cats, and hopefully by the end of this session you'll see why I chose the particular questions that I'm going to ask you. Then we'll talk a little bit about why dogs and cats develop diabetes. We'll talk about the clinical signs that they typically present with, and the clinical signs that we're going to be monitoring through their management. We'll have a look at how the patients are typically diagnosed, and then we'll look at treatment and monitoring, and I'll use some case examples to highlight some of the complexities of managing dogs and cats with diabetes. So hopefully it'll be an enjoyable session. So question number one, cats with diabetes mellitus, do they always need insulin long term? So do we think that's true, false, or are we going to step aside and say don't know? So do cats with diabetes mellitus or sugar diabetes, do they always need insulin long term? So that's the first question to consider. And the same question but applied to dogs. So do dogs with diabetes always need insulin long term? So do we think that's true, false, or again do we want to sidestep that question? And then if we've got a cat with diabetes, do we think that cat should be fed twice daily? Or perhaps should we be thinking about feeding that cat in another way, like continuous food down the whole time? So if we've got a cat with diabetes, should we feed that cat twice a day? Is that true, false, or again, are we going to sidestep that question? Right, and the last question, we've got a patient, we've got a dog or a cat who's been diagnosed with diabetes, and then we're looking at the best way of monitoring that animal longer term to give the animal the best possible quality of life that we can. Our aim is always to give the dog or cat the best quality of life possible, get them back to where they were before they were diagnosed with the disease, if at all possible. So let's look at the ways that we could potentially monitor a diabetic cat. We could think about glucose curves. So typically these are done in a vet practice. Sometimes we can do them at home, and we'll talk about that a little bit more later on. And with a glucose curve, we're probably looking for a blood test every 2 hours over about a 12-hour time period. So that's the glucose curve. Fructosamine, so that's a blood test, and it's a single blood test, and what it does is it looks at the blood sugar or the blood glucose level over about the past 2 to 3 weeks. We could think about a one-off blood glucose or blood sugar measurement, so just a single blood test to measure that blood sugar. We could think about making all of our decisions just based upon the animal's clinical signs. So are they thirsty, are they hungry, are they losing weight? Or maybe we're going to monitor our diabetic animals just based upon a urine test. So what do we think is the best way to monitor a diabetic patient, whether it be a dog or a cat longer term? A glucose curve, the blood test that looks at the glucose over 2 to 3 weeks, a one-off blood sugar, clinical signs, or a urine test. So that's the last question to have a little think about.